Hello there. Just an important announcement. Our session here will start in another 15 minutes. So if you can hurry up, we will need the room back to prepare for the session. In addition, we will have a side event downstairs on home care. So if you're interested in participating in the home care session, please come down to the second floor.
test. Test, test.
our second announcement. Our session will begin in another 10 more minutes. 10 more minutes. So if you are attending our session, please can you move up to the front stage? Move up to the front stage. Over here, to the front. Close, close, close. Please. Our session here is entitled Scaling Up Community-Based Organization Relevant to Aging Society. Ask them to please. Can we get some more chairs in the front? And also, can we have some people to help clean the table in the front here? If we can get some people to clean the table. Okay. Okay, okay, very good.
So you have a presentation in this session? I think you are thinking and they are going to in this session. You have a presentation. Okay.
Oh, sorry.
One is answering, responding.
Can you come help? So we need to set up this thing. Like that.
Hello, hello.
Table 1, table 2, table 3, we have all the tables
For
here.
those attending this
That, and this
session number 3, we would like to request you to occupy the first 3 tables in front and then the second 3 tables behind it, so that then the rest could actually, the staff could help us clean the rest of the room. Yeah, we would request you to congregate in only at least the first 6 tables, the first 3 in front, and then the next 3 tables behind. You need to, because we will need to group, there's a group discussion, Eva, please. Can I request for the slides, my slides to be put up already? May I please request from the technical team to show my slides already? Okay. Eh, how come it's a bit funny? Why is it funny like that? Okay. Okay, thank you very much
For this session, I would like to invite all of you to come closer to the stage, so we can engage. Okay?
it's also, hi, Hi, sorry. It's also easier we're going to have a group discussion after the presentation. So if you don't mind, perhaps you could help us make it more efficient by moving now to where there is an indication of a table number. If we have more than 6 tables, because there's more people, it's a happy problem. We could always have a table number 7. But please congregate as much as possible into the 6 tables we have identified. So the 6 tables are free seating, so you can sit anywhere. It's okay. Okay, we have a happy problem. We have more than 6 tables, so that's a happy problem. We have more groups. Okay, we'll just give the very hardworking staff from the convention center, so that then I don't fight against the noise of the plates and cutleries. So let's give them another 5 minutes perhaps to kind of majority cleanup, and then we can start the session. Thank you very much for coming back and deciding to join session number 3, scaling up of community-based organizations in aging societies. Can I start now? Okay. Good afternoon, everybody. I hope you had a wonderful lunch. And it's going to be a struggle with the noise of, but we will make it happen. And we'll have a fun in the process. So welcome to our session, promoting the national scale-up of older people's associations in Asia, or OPA. Our session objective is really to explore the process by which community-based organizations that are older person-led with intergenerational membership has become sustainable and scalable, what triggers their adoption by older people themselves in the community and by policymakers, very important, and what are the challenges and steps needed to have them adopted by policymakers, especially at the national level, and in terms of the replication or enhancement or making sure that it's mainstream across the country. My name is Susana Concordo Harding. I actually work for SAL Foundation. I'm the senior director of one of the initiatives of the foundation called the International Longevity Center, Singapore. But I'm also, SAL Foundation, since August 2022, has actually catalyzed the formation of a regional alliance that is working to promote the overall well-being of older people in Asia Pacific in our region. And we have community-based organizations is one of the strategies by which we believe that an important mechanism at the community level to be able to ensure that no older person will be left behind, that there's opportunity, not just for the current cohorts, but as well as the future cohorts of older persons all over the region. So for those interested to know more about ALAP, you can approach me later. At the ALAP level, actually, we started also looking at what are the good practices in our region. Our region is actually very rich in terms of history, experiences, and expertise in terms of building community-based organizations. So some of the good practices that the ALAP has come up with, recently we're doing a study on this, just from among the ALAP membership, but certainly has a lot of alignment and similarity with the whole presentation this afternoon. So I thought I would just want to share this. First one is really around community empowerment. Through participation of older persons, training and capacity building is very important in building community-based organizations, not just of the older persons, but certainly the team that is working and facilitating those empowerment process. Inclusive and participatory approaches, very, very important that we are mindful of the different cultural contexts, the languages and other community culture that we have to work with. Advocacy and policy engagement, which is very important because if you start at the community, then how then do you scale it up? How then do you replicate? How then do you expand your areas of communities? Feedback and continuous improvement. And in a way, this session is a testament to how different organizations in the community working with older people have actually evolved and managed to utilize feedback and the continuous improvement such that we actually end up with 9 presenters today. So that's how rich it is. And the last bit that we are seeing is really about how are we leveraging on community strengths and resources, so we're not starting from scratch. We are actually leveraging and utilizing whatever is there from the community, and then kind of like augmenting it through the support of outside partners, whether it's funders and especially policymakers. So this is a work in progress for ALAP, and we're hoping to come up with a report actually out of this study within the next 3 months. We have a very rich number of models and presenters this afternoon, and it's also a testament to how the region is massive enough that all the innovations have been happening since decades ago, and we have 9 presenters today. We'll start with a lady because of she needs to leave after her presentation. So we are actually shifting her presentation first. So let me introduce them. So I put them in one slide. So the first, and this will be the order. The first presenter will be Thuy. She's actually the country director of HelpAge International Vietnam. To be followed by Queen Tran, maybe I should say your surnames as well. So, because I know them personally, so Queen Tran, who is the Older People Association Development Advisor at HelpAge International. The next, after him, is Vera Tam. He is the Executive Director of HelpAge Cambodia. Then the next one after him is Mr. Vichai. I'm Choka Vivat, I hope I pronounced, Senior Citizen Council of Thailand President. And then after that is Samantha. Samantha Lianawa Duj. Did I say it correctly? I always call him Sam, so he's the Executive Director of HelpAge Sri Lanka. And then we have somebody from the World Bank, Emiko Masaki is here for me. She is the Senior Health Economist, East Asia and the Pacific region of the World Bank. Then after her, we will shift to the local national Indonesia. Our host, Ms. Rita, Madam Rita Erawati. She's the Director of the Family, Women, Children, Youth and Sports, Ministry of National Development Planning, or BAPENAS in Indonesia. And the last but not the least presenter or who will share is from China, Wang Longshuan. He is the Division Chief of the International Exchange at the Department of Program Development, International Affairs, the China National Committee on Aging. Okay, and then the 2 ladies are actually very, very valuable support to me today, because after the presentations, we will have group discussions in each table. We have 2 questions. We would like to kind of hear your voices on these 2 questions, and we kind of would like to have an Asia-Pacific style of cafe. So you will actually answer the 2 questions, but you'll shift the questions. So we'll explain that later. So one is Ria. I have to go up. Ria is Ria Tariq. She's the Director of Global Impact at HelpAge International. And our documenter, Gemma Stovall. Yes, Gemma Stovall. I don't have your, from HelpAge International. I forgot your position. Okay, so with that, just kind of give a very participatory, but kind of very firm encouragement to all our speakers to please keep to your sharing presentation to 5 minutes, except for Queen, because he's giving us also 5 minutes, wow. I like that, he's been challenged to also keep it to 5 minutes. But the important thing, they will be focusing on three areas. First, what is their model? The second is what is the current situation of their model, how they have done community-based organization. The third thing is how they manage to convince government and the scalability as well as the adoption of their model such that it's actually being replicated, being mainstream, being enhanced or expanded to the different parts of the country. And it's a very good, rich learning platform for us this afternoon. So with that, I call on Tui. Please give her a round of applause.
Good afternoon, everyone. I would like to invite two gentlemen with me because I'm only the representative of the team of Vietnam to present the Vietnam model, intergenerational self-help clubs. And next to me is Mr. Khư. He's the vice chair of the Vietnam Association of the Elderly, the organization who is the Prime Minister of Vietnam, assigned to be in charge of our OPA replication. And he's also the parliament member. And next to me is Mr. Dong. He's from the Social Welfare Ministry, Molisa in Vietnam, and the one who works side by side with us. That is the reason why now Vietnam already replicated the model nationwide. So thank you very much. Yeah. Yeah, 1 minute has passed, I think. So what is the intergenerational self-help clubs? It is the social community-based voluntary organization consisting of 50 to 70 members. And it is established at the village level. There are about 4 or 5 or 6 neighborhood groups, and the club members are encouraged to I don't know why, to register to join the different interest group. It is included the... This is the work forward. Yes. I think that we get the, not the question, yes. Yeah, not yes. So there are many interest groups within the clubs, the social and cultural group, physical exercise group, home care volunteers group, livelihood group, and many others. And the club have a number of area of activities, and a typical ISSC have at least 8 core area of activities. As you can see in the screen, it's cover the cultural and social area, food and income security, health care, community-based care through the volunteers, and emergency support and community development, lifelong learning, right entitlement, and resource mobilization. And with this, we are very happy to see the very rapid growth of the ISSC in the country. After more than 10 years, testing and improving the model. And according to our network member association of the elderly, by end of August this year, we already reached more than 7,300 intergenerational self-help clubs in all the 63 provinces in the countries. And next year, it is expected that we will reach 9,000 OPA, our ISSC, in the country. And this is because the government, sorry, it is not the latest version, but I think that the reason why we have that very rapid scale up, it is because the model is very attractive, and we have the evidence why the government or the policy maker should pay more attention and invest into the model. It is affordable for the low-setting countries like Vietnam. It is sustainable, very dynamic, and it is really in line with the government priority in the social protection, healthcare, and solidarity. Yeah, and because the need for the ISSC in the country is so huge, so that is why now our Association of the Elderly trying to advocate the government to develop the next phase of replication of the club in the country for the period of the next year period. And we are now, with the financial support from the government of Japan, through the GFDF and World Bank, are working to digitalize the ISSC training material so that we have the online material to support the national-wide ISSC. And we also provide a number of TOT training for trainers and standardize our manual so that more ISSC, more OPA can benefit from that with less technical support from the national level. Yeah, and also together with other development agencies like financial support from COICA, UNFPA, the World Bank, and Heritage Korea and others, we are now sharing the ISSC not only within Vietnam, but also at the regional and global level. Yes, there are some lessons learned there, but I do not think that we have enough time. I would like to take this opportunity to acknowledge all the support from our donors, our development partners, and our friends who work side by side with us during this process. And thank you very much.
Three. I think this is very important.
Because we said no time.
Yeah, can you just show that last slide? I think it's a very good learning for all of us. Hey. Can you just show that last slide, please? It's a moderator intervention. Okay, I think this is very important because I think what they have learned is something that all of us here could actually bring to our own communities, to our own experiences. I know she has got to leave, but just look at the learnings. The trust in the community is very, very important. Of course, Vietnam is a very organized and very structured down to the village level, but still trust is very important, and how that trust is actually experienced and consolidated at the national level as well. Having a champion to pilot test the model, investment in the initial grant, and I think what was the initial grant and capacity building that they have done for the management board, club management board, because they would need support to be able to do a lot of things. Have the evidence, the data, to then be able to influence policymakers that your model is working. The role of the VAE, the Vietnam Association of the Elderly, for continuing support. So you need to find also how you can, at the community level, but also how you can find support at the national level. The role of international donors and organizations in supporting the standards of how the whole model has actually become such a scaled up program right now in Vietnam, and kudos to Tri and the whole of the team. So let's give them another round of applause and wish her safe travels, Tri. Okay, the next one, Quinn. I still give you 5 minutes, okay. Not to worry.
Can you present the second presentation?
Slides, please.
So second, yes, my name is Quinn from Health Age International, and today my presentation will be on Older People's Associations, or OPAs, in Asia. And my presentation will be in 4 parts. Part number 1 is on rapid aging. As you can see here, our world is rapidly aging, especially in Asia, where 60% of the world population of older people are living. Therefore, the number of OPAs, or older people, will increase, as well as the number and the need for OPA will also increase. And since then, we have worked with our countries, various countries in the region, to promote the development of OPAs. There are now more than 1 million OPAs in the regions. And Let's go that way. In the region. And so what happens? This will lead to part number 2, the evolutions of OPAs. In the past, most of our OPA were very project-focused OPA. When it's a health project, we will have health OPA. When it's a livelihood project, we have livelihood OPA. Easy to establish, but not hard, very hard to maintain and scale up. So we evolve. Our OPA to make it more multifunctional, more sustainable, scalable, and nationalized. As you can see, because of this, we can see we have higher and wider buy-in, higher durability. It's sustainable and also scalable once we evolved. Our third one is that scale up, OPA scale up. So now we have this amazing OPA. How can we scale it up? So this is what we have done. We first developed thousands of OPA materials for the country to develop. Second, we organized large number of countries, regional training and exchanges. And third, we also supported the development and resource mobilization for OPA development in various countries, as well as help countries develop policies on aging. So as you can see, here are some sample, lots and lots of OPAs in very large number of countries. Many have national OPA as well. So how did we do this? So we have what you call 4 stages of development where we would like to recommend you to think about. First, you need to develop a OPA model that stands out. You must gather lessons learned and also impact evidence like Thuy has said. This will show you a product that works. Then after that, you would need to do some scale up, standardizing, so that when people want to scale up, it's easy, fast for them to replicate, while also ensuring quality when you replicate. Now you have a model. Now you go to the third step, is the branding and the marketing. Nobody knows your model. You need to start branding and marketing. This is something that our partners in the region lack. We have amazing model, but nobody knows. Once that one, then we go up to the next stage of development, is we call it the franchising. The franchising is now you have customer, you need to replicate it, you need to train others so that others can replicate. You cannot do it yourself. The country is too large. The country is just too large. You need to train others so others can replicate yourself, like that. So these are some examples. But this process will continue, and your model will continue to grow and develop as your country changes, as your country develops. It cannot be stagnant. So what is our next step? These are our 5 next steps. First, we will continue to help countries to analyze their OPA model and develop plans. Second, we will offer OPA trainings as well as improvement in the model. Third, we will support country office or network members to do branding and marketing of their OPAs. Each country has their own OPA model. Fourth, resource mobilization. Now you need a lot of funding to scale up. So where would the funding come from? And the last one is promote OPA national setup, like this one. Especially you need a government agency to be in charge of OPA development. Countries that have managed to get to 1,000, 10,000, 100,000 OPA normally has a government ministry in charge of OPA development. You need to have that. So my conclusion is that first, shift your OPA to the more advanced one, the more multifunctional, more intergenerational, more sustainable one. You will increase your attractiveness and your popularity to your OPA. Then you follow the 4 steps for OPA scale up, and then follow that. If you do this, it will provide you greater and lasting impact. You will be able to reach millions and millions of people with the limited resources that your country has. And we'll go back again, back. And it will increase your visibility and credibility. Like, for example, Thuy. Many people knows her organization because why? Because of her OPA model. And lastly, it will open up new opportunity for partnership, for collaboration, and for funding opportunities. And so that is the end of my 5-minute presentation. Thank you.
Queen. Thank you. Queen has been following all of us in the region in terms of how we have been developing and innovating and scaling up our community-based organizations. I have 2 mics now. Should it have happened? My bad. I said that China is the last. Of course, there's another big country in our region, which is India. So actually, we have also a representative from HelpAge India who will be also sharing their model. So the next presenter is Vera from Cambodia. So we're kind of going down from Southeast Asia.
Yes, thank you, Suhana. Good afternoon, everyone. I'm very delighted to be here with all of you today in the conference. Let me begin with the. Oh, yeah, okay. So I will cover 5 points for the presentation today. As actually Thuy and Queen have presented very clearly about the OPA, Older People Association, the Intergenerational Self-Help Club, the function, the way that it's established, and how it's benefit to the older people and the community. So I will bring you to more detail about the context in Cambodia, include the background and the OPA development model, and also some challenges. So HelpAge Cambodia is the organization that have localized from HelpAge International since 2012. It exists in Cambodia actually since 1992. We focus on 3 main programs. First one is the promoting and supporting the community-based organization, the OPA model. Secondly, related to support the community in addressing the health, the income, and the risk reduction related to the climate and the other natural disaster. And another important program is on the policy advocacy. So we are currently supporting over 240 OPA across the country in 9 provinces out of the 25 provinces in Cambodia. And these are some photos of our activity that we have supported the older people, and especially the OPA. So looking at the policy framework that are supporting and promoting older people association in Cambodia, we have a number of policy and guidelines, including the national OPA establishment and management guideline that endorsed by Ministry of Social Affairs in 2008, and later on the OPA guideline as well, plus home-based care endorsed by the Royal Government of Cambodia, and national guideline on WASH for older people and people living with disability by Ministry of Rural Development. And also we have a national aging policy that enacted in 2016 for 2017 to 2030. And just back a little bit, so the supporting the OPA, we have in Cambodia, Ministry of Social Affairs is the leading agency in promoting and supporting that. But at the same time, we have also the development partner and also civil society, especially HelpAge, Cambodia and the UNDP doing this work with support from some of the donors, you can see, including the BMZ, UNFPA, HelpAge Korea, HelpAge Deutschland, and HelpAge International. So I think this is a wrong slide, and again, see it's just back and forth. I'm sorry for the technical error. So let's just go a little bit, and I apologize for the error. So this is the picture of how the OPA in Cambodia have been developed. In 1998, we firstly introduced the OPA model in Cambodia, and then after 10 years, as seeing the benefit of the OPA, government have recognized the model, as you can see, in 2008 by the Ministry of Social Affairs, and 2013 by the Royal Government of Cambodia as a national guideline. And in 2016, Cambodia have started replicating the OPA model across the country, meaning that every commune in Cambodia have OPA established by the government, by the Ministry of Social Affairs. And but I think this is not a very success case that have been replicated, too quickly. So in 2023, we have learned from other countries, especially in Vietnam, from the IAC model, and then we are working collaboratively with the government in reviewing the model. So looking further on including the younger people and seeing as intergenerational self-help community. So yeah, you can see in 2024. And so here in Cambodia, we have, at the moment, we have 3 different models. Firstly, established by the government, which cover larger, at commune level, and NGOs such as HelpAge and others, association. We established at village level, and it's more led by the community members. But for the government model structure, it's more top-down, which mostly the president is nominated by the authority, mostly the commune council, and the village chief play the key role in the structure OPA. And also we have another model which is formed by community. I think this is a good result from the national guideline that the community have established it themselves. But the model have some differences, as they mostly established, at Buddhist temple level, as a lot of older people in Cambodia are Buddhism. And there are some factors that lead to the national replication. As you can see, I try to reflect more with from the duty bearer side, that Cambodia is low middle income country. It's a least developing country, so the budget is one of the factors that the country cannot spend much time on the program on supporting the older people. So, and the older people, the OPA is recognized as one of the effective model that it's cost effective as the previous presenter have shown. So it's recognized that this is a lower cost. And also at this stage, because of many OPA that have replicated at, especially at commune level, they are not so active. So this brings to another plan that need to review and on the standardizing and scaling up again. And there are some lessons that NGO and include CBO themselves, OPA themselves, that they can run independently and more sustainably. Actually, we have some lesson learned. I had to go back. Yes, there are some challenges and lesson learned in Cambodia because the government have enacted, the law on association and the NGO. Later they enacted the guideline on OPA establishment. So this bring a contrast, that require the CBO, the OPA, to register at national level, which is not really applicable or work for them. And although there are a lot of policy framework, but in Cambodia, they at some area with the OPA, it's not very clearly mentioned on how to OPA should be supported, and including the limitation of policy implementation. One of the another important challenges that bring that made the OPA replicated not very successfully because I think they too ambitious. They always all try one to replicate it too quickly and do not want to invest much. I mean, they just do not want to spend on training, on capacity building to the newly formed structure, and this is the problem. And with the OPA, when we conduct the new, reform for what that already established but not strong, we encounter a situation that there was a scammer. There were cheat. They create a similar association in Cambodia, collecting the money from the members, and then they say they return with paying a very high kind of premium or return when for the funeral. For example, you pay $100 per year for a year, you will return 10,000 US dollar for your family. And so it happened, and until ministry closed down, but it later on affect when we want to continue with the replication. And another important thing, I think, like Thuy mentioned also about the succession plan for the committee. I mean, the leadership. I mean, especially when for the first round, it's okay, but when there is a change in the leadership, so it's have some difficulty for community themselves to provide the training. I mean, knowledge sharing to the other members. So the next step in Cambodia, we are working to. I'm sorry, I can't. Yeah, just the.
You can
just
emphasize what are the next steps.
Yeah, just next step. We in Cambodia is working to develop a manual that we have worked together in redefining the OPA model. So this is, and also since I mentioned earlier that the policy is not comprehensively highlight the support to the OPA. So another important point is to develop an inter-ministry policy to support the OPA. Well, I'm sorry for taking a lot of time, and thank you for your attention.
Thank you so much, Vera. Not to worry, Vera. Very important experience in Cambodia following the ISHC model from Vietnam, but you can see that because Cambodia has a different context and a different kind of how it's organized, it's actually also evolving in a different manner than the Vietnam experience, but certainly a lot of room for achievements and growth for Cambodia. So they're going to be in thousands as well within the next few years. So the next presenter, I encourage you to look at Queen, and then when he puts up his magic cannot be seen, kind of, that means you only have 2 minutes. Ken? Thank you very much. Do you need me to?
Yeah, yeah.
I can do it. I can
Okay,
do it.
okay. Thank you. Thank you. I would summarize that after Senior Citizen Council of Thailand has established about 35 years ago, we set the goal. To keep the older person to be strong, to be the strength of the society instead of the burden of the society. This is our mission. And 2 strategies we have done. One strategy is to work with the government, to push the government to do everything to keep the older person strong, to be strength of the society. And the second strategy is to work with the older person in the country. To work with the government, we are quite successful. We have a lot of success story. First thing is that we propose the government to help the older person who are underprivileged, and we can start in 1991. The government support about $1 million for the underprivileged older person. This is the first year. But now, this year, the government support allow $30,000 million to the older person, universal coverage for older person throughout the country. This is one success story. The second success story is in 2002, we can achieve universal health coverage for the whole country and cover all of the older person. Now, every person can get a health service with only 30 baht for fee only for the whole country. And we can spend money for this scheme very economically, because we spend only about 4% of GDP of the country for the healthcare for the whole country, only 4%. Compared to the UK and Japan, it's more than 10% now, and in the US it's about 18% already. But in Thailand, only 4%. This is the second achievement. The third achievement is that in 2003, we can push the government and declare and enact an act, Older Person Act, and there is the Older Person Committee, National Older Person Committee, and I myself, as the president of the Citizen Council of Thailand, are the ex officio of the standing member of the second vice chairperson of the National Older Person Committee of the country. This is another achievement. And another achievement is that we have we have a national saving fund, for the whole country. That if when everyone start to work and save only 100 baht every month, the government will add on 50 baht for every month. And when he was 60 years of age, he can have their own pension, more than 1,700 baht every month. This is one another achievement for the national policy. And for the older person, we have some other project. One project is to promote the older person, to organize the older person club. And the older person club now set up about almost 30,000 older person club throughout the country. And after we have set up, about 15 years ago, we have survey for the older person club. We have set up long time ago. And we found that only few older person club still alive. And very few are quite active. This is the nature of the older person club. I think on club in the developing country have the same situation like this. So we try to strengthen the older person club. First, we set up the criteria that how to promote the activity of the older person club. And we declare the criteria to encourage the older person club throughout the country. But it doesn't work. So 15 years ago, about 15 years ago, we start one project when our king have 88 years of age. We start with 88 older person club to strengthen this club, and it worked quite well. And we found that the mechanism to make the older person club strong, that is to set up the older person school. This is the solution that we have found, and we try to encourage the government to adopt this. And the older person Department of Older Person Affairs in the Ministry of Ministry of Social Security have adopted this idea, and now there are about 2,327 schools already throughout the country. And then we start another project. The project now we divided the older person who are the member of the older person club in Thailand into 3 groups. The first group is the incoming older person, age 45 to 59, to prepare to be the strong older person in the future. We encourage them to do 3 things. First, to keep them healthy. Second, to encourage them to save money for the economic security in the future. And third, we encourage them to work with the community, to engage with the community. This is the three things we encourage the incoming older person to be well prepared in the future. This is the first group. The second group is the older person aged 60 to 79. 60 to 79. We encourage them to enter the older person school every month, so they can have activities. And for the third group is 80 years up. In this group, Most of them are bedridden and or homebound. So we have to rehabilitate them. So we work with many organizations, with the local government, with every organization, with the temple, Buddhist temple, with every organization, community organization, to try to rehabilitate those bedridden and homebound. This is what we have done. We have done, and we are quite successful with about 500 older person club already. And in the end of this year, we will try to encourage the 500 older person club to do with another tool. So next year we will have at least 1,500 older person club will be quite strong. And we can communicate with them through, we set up the slide group between us. And every time they have activities with the older person, they send, they post to me, they post to in the group. So even here, I can learn that what are they doing, and I just give them the light. Yeah. So they are happy that everything they have done are recognized by their president. Thank you very much. I have prepared some paper on this. Anyone who want to read, you can pick up. Thank you very much.
Thank you. Our next presenter, please. Hi, Sam.
Good afternoon, everybody. We got a presentation. Okay. Okay. I'm representing HelpAge Sri Lanka. HelpAge Sri Lanka is a country with 65,000 square kilometers and a population of about 22 million. And the aging population at the moment is about 16%. And there are predictions that we are going to reach 20% by 2030 and 25% by 2045. The life expectancy, male is 74.4, female 80.7, average it is 77.7. Okay, HelpAge Sri Lanka established in 1986 and initially guided by the World Assembly. And main office is in Colombo, and we have a board with 11 members and staff of about 86 and 5 office volunteers and then 500 field volunteers we have. And our main programs are restoring the vision and health of the elderly, and then also developing these elders clubs and extending programs to the whole, spreading out the programs in the country. We also do handle advocacy and rights-based programs and projects. This Older People Association, actually HelpAge Sri Lanka has set up the first Old People Association in Sri Lanka, the first one in 1987. And then we have done a project, we have done a study on that Old People Association. And then we managed to convince the government to take this into the account and put it into the government system. So thereby we managed to include that into the Elders Protection Act number 9 of 2000. In 2000, we have managed to put it into the Elders Protection Act. So the basic idea is now we as Asians, we depend on the families to take care of the elders. So the next step we can do, next thing what we can do, we depend on the families to take care of the elders, and then we depend on the community to take care of the elders. So that concept has been developed through this elders clubs concept. So we have in Sri Lanka, we have 14,025, it is in this. It is in this 14,085 Gram Nildari divisions. Gram Nildari division is the smallest administrative division of the country. So we have 14,000 Gram Nildari divisions. So under the Elders Protection Act, in each Gram Nildari division, so that is village headman, Gram Nildari, so each village headman's unit, they can set up an old people's association. So we also call them as senior citizens clubs. So accordingly, 14,000 has to be set up, but at the moment there are only about 11,915 set up. But not only that, those grassroots, ground level 14,000 elders clubs, also they get together, the office bearers of those clubs, they got together and they form divisional level senior citizens federations, division level senior citizens federation. And then office bearers of those get together and form the senior citizens district level. We have 25 districts in Sri Lanka. So 25 senior district level federations are formed. And then the office bearers of those 25 federations also get together and they form the provincial level. We have 9 provinces. So provincial level elders federations. And those 9 provincial level federations, they communicate and get together and they form the national federation. So it's a very planned network we have. So from top to bottom or bottom to top, you can communicate. There are communications and it is governed by the government. So this is part of the Elders Protection Act number 9 of 2000. So it is monitored by the government. So every divisional secretary's office, there's a Elders Promotion Officer, ERPO. So he monitors these elders clubs. So not that all these 14,000, no, at the moment there are about 11,000 formed, but all, okay. Sorry. Okay, so this, as the other presenters said, all these 11,000 clubs are not very active. So, but one thing is that we have a government officer to monitor them. So therefore, fairly these clubs are active in their work. So, yeah, okay. So at the moment, out of 14,000, 11,000 has been formed and they are in operation. So Helpage Sri Lanka, we have a role in doing, we work hand in hand with the government. So this is under the government, we have set up this Old People's Association and the network, and we are supporting them by way of, if any elders club is not functioning well, we will look at this club and then try to form the club again. And also we support them to build their capacity. We have training programs to build their capacity. And also we we have HelpAge Sri Lanka have some mobile medical units. So we send the mobile medical units to these villages, and then, I mean, with the communication, keeping the communication with the elders clubs, we screen them. Actually, we restore their, many of the elders are having impaired vision, so we check their eyesight, we give them the spectacles which are necessary for them to restore their vision. And then those who have cataract, also HelpAge runs our own eye hospital, where we refer them to our eye hospital and get the cataract surgery done, and then restore their vision. At the same time, we also try and look after their health conditions and try to improve their health conditions. And then give me a minute, I'll finish this and I'll answer you. Okay, so the senior citizens committees, we are working very closely. At the moment, we are directly monitoring about 1,544 elders clubs. And SEC formation, this mobile medical unit, and then by restoring their vision and also making sure that they have good health, then we go out and give them some other programs like livelihood assistance and capacity building, and also training on various projects and programs, and also keep them active. We introduce even day centers. I mean, any elders club who has the capacity of setting up a day center, we promote that idea. And even the government system also supports this. So formation of the clubs as well as setting up day centers are also supported by the government. I think there are many more things to tell you. Gwen is stopping me. So thank you very much. If you have any questions, you can ask. Yes. Yes. Government is not giving any funds. We have our own fundraising activities, and also we get a lot of support from HelpAge International. That is one way, and also we have our own fundraising projects. So we have different projects. We print and sell greeting cards, then we have collection tills programs, we have direct mail, individual donors, we have a donor database, so they support us. And then also we have some investments where we get some income. So we have recently achieved 50,000 surgeries. Landmark event was celebrated last month. Thank you very much.
Thank you, Sam. Thank you. A very good way of saying that they are able to mobilize resources on their own through fundraising. We're halfway through. We still have 4 presenters, actually. So if you don't mind, can I say that could we keep to the 5 minutes? Otherwise, you won't have the chance to have that's the unfortunate part of being the last half, the second half. Please. Thank you.
Thank you. I'll try my best. Good afternoon. My name is Emi Masaki. I'm a senior economist from the World Bank. Thank you. As a multilateral development bank, our role is really to help the countries, the government and countries to apply the innovative solutions and to address their development challenges. And then that is often done through the 2 ways. That we have an investment project to support that countries to provide the sufficient resources to scaling up the critical activities. And we also do that activities through knowledge generations. Okay, so what we do in terms of engaging in this aging issues in Asia Pacific, we do it through the knowledge side. Most recently in 2023, we have published 2 flagship reports in these regions. One is called the Silver Opportunity, looking at the building that integrated services for older adults. And another report that came out also last year, it's called the Silver Feuds, building AIDS-ready cities, and both of which where we think that it's critical for the World Bank to generate the new knowledge and also supporting the key policy dialogue in the countries in Asia and Pacific. On the investment side, we have two ongoing projects in China which support the aged care system demonstrations in Anhui, province of China. And we also support that the aged care system development in Guizhou province in China. This is how we engage on some of the key challenges that country face in the development challenges in Asia and Pacific. And I also like to kind of zoom into what we do in Vietnam, where I actually have ongoing engagement as a World Bank together with my colleague here in Nga, is to support the aging, the policy, as well as the addressing the implementation of the aging policy in Vietnam. So in 2019, we have started working on these issues on aging, and we developed the report. It's called The Aging in Vietnam, which actually highlighted the number of key recommendations, and one of which was to really look at the self-help clubs or group are indeed seen as the backbone of the care provision in Vietnam. The another important recommendations that we came up is a community approach. It's really cost-effective way to provide the support and care, in particularly for those countries that the resources are rather limited. And Vietnam is aging, as we heard it from the speakers, but also aging while countries are yet to become high-income country. And many of our partners and friends who are here today is also looking at where the resources, how country can manage to meet with the aging challenges. So it's coming back to us to really looking at community model is a way to look at in a setting where the needs is great. Okay, so let me just briefly introduce the project that we do with the funding coming from the government of Japan through the Japan Social Development Fund, which Tui has also mentioned in her presentation. So we supported the intergenerational self-help clubs through this project and work with our Association of the Elderly and with our national partners, the Ministry of Health and Melissa, to implement this project in 6 provinces throughout Vietnam. So I think I won't go into these models, but this has been already presented. The club itself is covered 8 areas of core activities. And what is really important is for us to be able to show the results. So through this model, the project are able to bring the comprehensive and a long-lasting benefit for older people. And what we have done is also the very rigorous evaluation throughout the project. We had a baseline, an annual evaluation survey, midline, and now we're doing the endline survey. And it's very important to measure the impact, particularly for a partner like us, the World Bank. We need to show what are the impact. Does that making the measurable impact on the ground, and how much does it cost? I mean, those are very critical for us to continue to support that government policy. And what I really like to highlight, we see the all 6 areas that the survey that we did is having a very, very positive impact to the elderly, the older people. And many people said that they become wealthier through the income generation activity. They felt that they have more solidarity in a community, and they have more confidence as the older people participating in a community activities, increased knowledge, and of course being healthier and also being happier. Those are very important information for us to really to see that how projects are working. And for us, as a project, we always has the closing. And in fact, this project has come to close in December. And what is really important for us is how to sustain this impact. And from the beginning that we discussed the exit strategy for the bank, for the World Bank, to go how this project could be sustained after our funding closed. And it was very important to have a strong ownership, both at the community levels as well as from the local partners. And Tui also mentions in her presentations, alignment with the national policies and priorities are critical, so that the project activities supported through the World Bank funding is continue to find a way to be implemented. And this is done through both sustainability, looking at the institutional and technical aspect, through the capacity building. We have done a TOT, and we have also generated the digital materials to allow us to continue to support that training beyond. And of course, importantly, the financial sustainability as a project, as a club models, they have a revolving fund, income generating activities, as well as local fund mobilization, which allow that club to generate funds to do the activities. So this is my last slide. So indeed, the project or the intergenerational self-help club is really responding directly to the need of that poorest and most vulnerable and underserved group to improve their life. And this is the mandate or mission of the World Bank. And also scaling up of these innovative models, and then also for us to be able to partner with NGOs like HelpAIS International is very important to see how we can actually bring our knowledge beyond that current modality we have. And then we also really felt that it's important to have a participatory design and then consultation process so that targeted beneficiary address their own vulnerability and challenges to ensure that they have ownership and sustainability. And as I mentioned earlier, the rigorous monitoring and evaluation is a key. So we need to show evidence to inform that the overall project implementation, but beyond to the government as well. So as the World Bank, we have a knowledge bank that we also engage with the local government, national government, the regional entities, and global engagement to really share the knowledge and lessons learned from the project like this. So we hope that our engagement will continue through this the sharing of knowledge and lessons, and then also to helping the country to sustain the key outcome generated from your own experience, but to the broader the scaling up of the activities. So thank you so much.
Thank you. I have two advocacy for you. One is I hope the impact evaluation could also be done to other countries because there are so many, the World Bank could explore that. The second is around the last thing you mentioned about how to sustain these efforts beyond your funding. I think that's also very important. Thank you, but you've been a very good partner of the region, and hopefully you'll expand to the rest of Asia Pacific. We have got 3 more presenters. Okay. Indonesia, I hope she's, yes, madam. Is it gonna be in Indonesia? Bahasa? In English. Thank you very much. Okay. Thank you. Yes. So this is the forward, this is the backward. Forward, this one? If you need to go back, that's one. No, operate with. You want me to operate?
There's no.
There's no. I can help you, but you need to tell me to move the slides, can?
Yeah.
Okay, perfect. Okay.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. My name is Rita from Bappenas. It's to be honored for me to be here. First of all, I would like to thank you for the opportunity for me to share how Indonesia building collaboration with development partner and civil society organization called GSO in enhancing affirmative policy for older people in Indonesia. Next slide. For introduction, Indonesia is a rich country. Indonesia is a multicultural country that consists of 38 provinces and 514 cities, around 17,000 islands, more ethnic and also more languages. Based on the population census 2020, population in Indonesia reached around 270 billion people, with male and female population almost equal in number. In 2023, there is 1 of 10 households have elderly as a member of family. More than a half of them are as a head of household. Next slide. Now, Indonesia is facing an aging population stage. It's reflected from the increasing of percentage of older people by at least 4% from 2010 to 2022. Aging population is aligned with the rising of life expectancy. In response to this event, we have to begin think about how to make sure our older people could get healthy, wealthy, and also productive life. The next slide. Since Indonesia is a multicultural country with a lot of various in geographical and social cultural conditions, our government established multi-partner collaboration in development implementation. In our long development planning, 2025-2045, that at the moment we still preparing, there is a policy direction under, we call the Goal of Indonesia, Indonesia Emas, 9, regarding regulation, integrated and adapted governance that focus on the strengthening of capacity and meaningful participation from civil society. It became a basis for our government to build collaboration among multi-sector, including in aging population intervention. The collaboration occur from the planning stages, implementation phase, until the monitoring and evaluation of the development program. GSO could take many roles in the development process, such as becoming beneficiaries of development program, as a partner the government in implementation, emerging the innovation program from grassroots level to fulfill the development gap, and becoming a supervisor along the development process to give a positive feedback for the next policy formulation. Next slide. In the term of intervention for elderly, we already put this issue as one the priorities in our long development planning also, 2025-2045, under the goal of Indonesia, Indonesia Emas 14, regarding to quality family, gender equality, and inclusive society. In this context, we do some strategies which are, first, increasing the resilience of family. Second, fulfilling the right and protection for all family members, including elderly, with considering their particular need. Third, empowering people, including elderly, so they could participate productively in the development process. And fourthly, providing enabling environment such as infrastructure, family-friendly policy, building awareness and respect to elderly and other vulnerable of people. We also have a president degree on national strategy of elderly that consists of 5 strategies to ensure our elderly are able to live independently with good prosperity and dignity. There are first, improving social protection, income security, and individual capacity. Second, improving health and quality of elderly. Third, strengthening of elderly program implementation institution. Fourth, developing the senior-friendly communities and environment. And the last one is respect, protection, and fulfillment of the right and the elderly. To implement all the regulation framework, our government encouraged the partnership between development partner as well as CSO. The next slide. As a best practice, we have a collaboration with Australian government that we call inclusive program. Thank you for the government of Australia. By supporting the CSO, encourage the invention of national strategy on elderly implementation. In the grassroots level, there are innovation of elderly program that carried out by ICIA, Yakum Rehabilitation Center, and also PK. Asia is running the elderly daycare in the communities by delivering various activities through senior school. Additionally, Asia also provides the economic assistance program for elderly farmer and training for the nurse to support elderly care in the community or family. Yakum Rehabilitation Center, the first one is Islamic communities and the second one is non-Islamic communities. Yakum Rehabilitation Center organizes Taman Lansia Ceria, the Park of Elderly Ceria, as a comprehensive services for elderly, including mental health, art and creativity, sport, religion, and etc. Moreover, Yakum also have a training program for the caregiver, third certificate, and international standard of curriculum. The last one is PK. PK provides assistance for elderly in economic improvement and ensuring elderly could access the basic right fulfilled by Click PK program. The next slide. For conclusion, as a lesson, trust should be a fundamental foundation when we make a partnership with either development partner or CSO, same the first presenter. Secondly, we also involve them not only the implementation state, but in every state of development, including planning stage. So it builds the ownership of the program together. The next step forward, we have to think how all the partnership program can be sustained and give more positive impact for many people by arranging the effective exit strategy of program. Next, innovation to fill the gap of policy implementation become a prominent action to ensure all the elderly and vulnerable people don't exclude from the development. And lastly, knowledge sharing and replication are needed to spread the best practice to the other regions. At the end, I want to say that trust, collaboration, collective action, partnership, and mutual support between the government and civil society are needed to ensure no one left is behind in Indonesia and also the world. And for closing, let me read a pantun like Pak Maliki. Walking around in the island of Bali, looking for eating and enjoying the view of beautiful city. Partnership between government and civil society for support elderly, making our elderly productive life healthy and wealthy. Wassalamualaikum warahmatullahi wabarakatuh. Thank you very much.
Okay, I'm trying to look for the next speaker. No, China, and then India. Yes, sir. Oh, it's there.
This is the next.
Yeah, and then this is the back.
Okay. Not here. Okay. Okay, yeah. Yeah, I will be brief for time-saving purpose. I'd like to thank the organizers of this conference, HelpAge International and Bappenas of Indonesia. The first part of my presentation is about China's demographic change. In 2000, China is aging with its older population aged 60 and above, 132 million, accounting for 10% of the total population. And in 2023, China is aged with its elderly population to 297 million, accounting for 21.1%. And in 2035, China will be super-aged, with its elderly population accounting for 30% of the total population. And the OPAs in China, since 1980s, we have some national level associations. And till now, we have 554,000 OPAs at all levels, from national level to provincial level, county level to village level, and covering 95% of urban communities and 80% of rural communities. Since we have, China is a vast country, so we have different types of OPAs. And the funding for OPAs are mainly from the government financial support or from government budget, and the government purchased services, membership dues, or welfare lottery funds, and donations or any other fundraising activities. What do OPAs do? At the community level, mainly in rural areas, I'll first go with the policies. First, to introduce policies, laws, and regulations to older persons. And the second function is to keep in close contact with the elderly, meaning listening to older persons' opinions, understanding their needs, or conveying their reasonable demands to the government, or representing and safeguarding their rights and interests. The third is to deliver services for the elderly and mutual assistance. The fourth is to promote a positive and healthy way of life, guiding the elderly to choose scientific, civilized, healthy lifestyle, and also organize cultural and sports activities. The last one is to organize the participation of older persons in rural and urban communities, such as intergenerational communications with young people on moral conduct. And they are also organized by OPAs to participate in local economic development, like income generating activities. The government attaches importance to capacity building and the role of OPAs. As you can see, the top level design to encourage the development of OPAs from the State Council. The State Council issued a document to enhance the capacity building of OPAs, and also to encourage and guide older persons to establish grassroots elderly social organizations, to provide guidance on and promote the standardization of OPAs. I'm from CNCA, so from my organization, we have a pilot program. In 2022, we had a pilot program in 7 provinces to enhance the capacity building of OPA management level. And the support to OPAs in this pilot program would be to give them, provide the subsidies, resources, supervision and guidance, and also training programs. And the prospect in the future, we will give fuller play to the role of OPAs at all levels by further improving management system, encourage registration of OPAs, or simplifying the procedures for annual inspection, clarifying the relationship between OPAs at all levels, and providing policy, funds, venues, technical support, and to make sure OPAs develop in a standardized way. This is a picture of members of OPAs. And these are the activities they take daily. Thank you. Thank you very much.
Yes, within the time. And the last but not the least presenter is from India, Mr. Ahmad, please. This one, forward, this one, if you want to go back. Yeah, this is the
Assalamu alaikum, namaste, and good afternoon. As Susanna said, I'm last but not the least. So before coming here, I tried to do a Google. What do you do to keep the audience interested in a post-lunch and last speaker sense? Believe me, I didn't get any answers. So I came here, and then when Susanna didn't mention my name, I thought I'll run away. But Susanna pulled me back. She said, you must present. So here I am. Thank you very much. So I'm going to talk about the elderly OPAs in India. We call them elderly self-help groups, ESHGs. My name is Imtiaz. I represent Helpage India, one of the largest NGO working in India, touching 2 million lives elderly through a 1,500 strong team. That's us. So moving on, how Helpage came to think about elderly in India as far as livelihood is concerned. So we are a large country, one of the largest, and we have a very rapidly growing elderly population with multiple vulnerabilities. There is a bit of social security issues, low pensions, and elderly are working as individual laborers with very low bargaining power. So we thought, what can we do? And we had this very bright case of the self-help group movement, which was the women's self-help group movement in India, which had the power of collectivization. They had small savings. They were able to do assetization. The federation power enabled them to access their rights, and they had social equality and equity because of being part of the self-help groups. So we thought, why don't we adopt these best practices and start collectivizing the elderly in what is known as elderly self-help groups. So we came up with this concept of ESHGs. That's this beginning. So if you look at the structure, in a very simple form, this is a pyramidal structure where basically the villages are the unit, and there are this elderly in a group. There are 10 to 20 elderly who basically come together, and they basically stick to 7 principles, which is regular meeting, bookkeeping, savings and loan, interloaning, repayment, social action and collective business. Community mobilization happens as with any community project. At the village level and at the district level, we federate them. So the representative of the elderly self-help group come together and become the federation at the village level and at the district level. So basically the federation's work is to basically look for the rights and entitlement of the elderly and look at the sustainability of the elderly in terms of the various enterprises and everything that they run. What you see here is basically the various activities and the time span in which it happens. So between 0 to around 60 to 75 months, the elderly self-help group matures, which is basically to see the community action, them starting the process of books of account, lending and savings, and then going into enterprise and social security rights and entitlement. So what are the components that we look at in the elderly self-help group kind of a paradigm is social inclusions, which is basically look at their rights and entitlement. They come together in a group and then they start saving and doing enterprises. So there is a bit of upskilling happening, income security comes through financial inclusion, and then there is a digital inclusion where we try to bring them to the digital highway, and health inclusion, we look at long-term care and improving the quality of life. We did a impact study with Tata Institute of Social Sciences in Mumbai. Quite a interesting and very impactful results is what we came to see through the study. Some of it we are sharing here. We saw that because of the project, there is a significant improvement of elderly in terms of the dignity within the household, because elderly were marginalized before, but because of the income that has come in, they're getting a lot of respect in the household. There is a social status improvement. The loan repayment is happening on time. 75% are able to repay their loan. And then their social interactions also has improved. Respect from the young family members have improved. So that's a significant achievement that we are seeing. In terms of the various factors that is basically enabling us to get a national buy-in to adopt this kind of a model is that this is a pioneering concept. Nobody has tried it. It is evidence-based. As you see the research studies, we do an empowerment approach, and it's a massive scale-up. We are present across 12 states, more than 5,000 groups, and more than 60,000 members. And in terms of the amount of money that exchanges hand in terms of loan, 106 million loans is what is the total portfolio size. And again, savings is more than 350 million Indian rupees. There is a good networking that is happening. Dissemination of the project learning is something that is happening very well. In terms of how did we scale it up, we have the two ministries which are involved, the Ministry of Social Justice and Ministry of Rural Development, with some representative from the Ministry of Rural Development also here. So both the ministries have done phenomenal work in something known as a program called Agrasar, which is basically looking at elderly self-help group and adopting it into the national policy. The concept net was developed, and 500 million was something that was allotted in the year one. And Helpage India was designated as the technical support unit in scaling it up. In terms of the policy framework, we've got good traction in the Agrasar program, and then there is a national action plan for senior citizen of the Ministry of Social Justice. So in terms of the intent, the program, guidelines, and funding, everything is in place and it's really scaling up. What are the next steps? We see five major steps that needs to be taken forward. The focus is now how do we strengthen the current project through innovations, whether it is in terms of the operations, technology, or greater linkages, and how do we drive the policy level advocacy, basically ensure that this is included in the various policies and intersectionality is explored. Sustainability is a big issue with financial institution, licensing and linkages, and greater engagement with the various for dissemination and content sharing. Key lessons that we have learned is that financial support and collectivization is a big thing because elderly need that platform for a collective bargaining power. And we also think that we also need to link with the government scheme and benefit for the sustainability after the exit. And digital is a big game changer that has worked very well for us. Those are the learning. Thank you very much. You've been a very patient audience.
Thank you. Okay, we actually have more than 6 tables now, and we have about, how many more minutes, Queen? 15? Q&A rather than the questions? Time's up. Okay, do you have anybody with a question? You could ask a question and then you could identify who would you like to answer. Yes, please, Reiko. We are, okay. Thank you.
Yeah, thank you very much for this very informative session. My name is Reiko Hayashi from Japan, National Institute of Population and Social Security Research. So I was impressed with some countries have a very complete this implementation of club, and then which might be based to religion, the temple, or some country are having the other the system. So maybe I have to ask particular question. Maybe when I was listening to Indonesia, we are now here, and it seems like the system is a bit different in Indonesia. Maybe you might have some other organization, maybe based on Islam, other than OPC. So if you have some more clarification, or maybe India can help us. And then by information, we used to have in Japan, we used to have senior club, and then back in 1997, we had 1/3 of elderly age 60 plus were member of this elderly club. But now we have so many elderly, so the number of people who are affiliated in the senior club, elderly club is now declining. And then I'm now 58, and I don't think that I'm going to become the elderly club in 2 years. But so I think what I want to say is that maybe country to country, different context. So my particular question might go to Indonesia.
Yes. Would you be able to answer? Who? Yakum. While we are trying to find, okay, yes, sir, please. Yes, wait, sir. We have got a question, somebody to
Check.
answer. Yes.
My name is Suyono. Actually, I'm working at the hospital and also the advisory of the Alzheimer Indonesia and advisor of the Indonesian Geriatric Society. I'm not going to represent the presenter, but just sharing the experience because you asked about how about the club based on religion, for example. I have a friend who is also a geriatrician. He works in the province of Yogyakarta. He developed this kind of how a community consists of not only the elderly people, but also the pre-elderly people, called the name, the Aishia is the name of the organizations. The activities there is not only screening the health, but also schooling for the elderly, for example. Also, they have the outdoor activities for those who are still fit and robust, but also they have a home care and home visit for those who are pre-frail and frail in the community. The people who works there, organized by this, my friend's geriatrician, is basically volunteers, cadres of volunteers who are specially trained for that work. The training session is also there for the volunteers, for the elderly, and also for the family members as the informal caregivers. So this kind of activities also, I know, exist in, for example, in the city of Bandung, in the province of West Java, where also my friend as geriatrician developed that kind of, mostly the daycare center activities like you have in Japan. My friend in Bali here, the Sahaja Dharma Sejahtera Foundation, developed this kind of activity after the pilot project of the National Development Planning 2 years ago. Screening and classifying elderly in the community into 3 levels according to their functional status and develop program according to this various level. So that's kind of sharing. Thank you.
Thank you very much.
Maybe can I add for Indonesia? HealthAge has supported Indonesia to pilot 80 intergenerational groups, and it worked fairly well. What is missing is the marketing and the branding. The marketing and the branding. So we established in Yogyakarta since 2018, and after 3 years, evaluation was very positive, but there was no marketing and branding of this one so that more people could be aware of it.
Thank you. As Queen has shared earlier, there are 4 stages. So I think if one of those stages have not been fulfilled, then sustainability could be an issue. You have a question? Yes, please. If you can just limit your question to 1 sentence, that would be very, very Appreciate it.
Thank you. Now we are almost hungry, so may not be.
Hungry?
Yes. We'll go for the tea, okay? Anyway, I have observed the presentation, and all presenter was presented in a very good manner, especially Sri Lankan presenter. I am very appreciative.
For sure,
Yeah,
for
yes.
sure. Sam
But
has
I
always
have
been a very good
question
presenter.
with Indian presenter.
the Indian, okay.
Question is, in any organization, their activity should be sustained with the financial backup, okay? But would you please explain how finance is coming to aid help of your organization? How finance is coming?
Okay.
Whether it is from the government and NGO or uh, CSR,
Yes.
corporate social responsibility, or modality of financing, I want to know
Okay.
from Indian friend. Okay,
Yes.
thank you.
You have very strong interest in financing. Mr. Ahmad, please.
Yeah, thank you. So as I said, when we started the Elderly Self-Help Group program in India, it was mainly through HelpAge International, the funding that used to come. So the experiment was started with HelpAge International Fund, but as we went ahead, we saw a lot of interest from corporates and philanthropy also coming in. And at the same time, what we did was we collected a lot of evidence. So the TIS study, the Tata Institute Social study that you see, is one of the main studies. There were other studies also done. So we continuously collected evidences in the project and used that to discuss with the ministries and the government functionaries to see how that could be also integrated into the national program. So we're very thankful to government now that's become mainstream and they have taken it up. But if you ask me frankly, not much appetite from the CSR for such project, but you get a lot of interest from institutional and other philanthropies who basically come in. But again, beginning was from HelpAge International and then moving into institutional and the government funds.
Hello. Unfortunately, you could have a conversation, the two of you.
Yeah, maybe we can take it up in the sidelines.
Offline. We don't have the time. I've been informed that the next session and the presenters are here in the room already. But if you have specific questions to specific presenters, please approach them after this. They're more than happy to have a conversation with you. But let us give the 9 presenters a round of applause again for sharing their models and for paving the way for our interest and our continuing commitment to empowering seniors in our region.
Yes.
Queen.
I have an announcement. If you are interested in attending the local government dinner for tonight, please go to the registration and get this invitation letter for tonight, for the dinner. So go downstairs to the registration table and get one of this, and you are welcome for the dinner with the local government hosts. Okay? So thank you very much for attending. And you have tea break, right? So. One more announcement.
I just trying to answer from a delegate from Japan that make attention for us for our presentation concerning the religion organization. Indonesia is multicultural religion, and the value of religion is very strong in Indonesia. So many government program also supporting with the society, and one of them is from the religion organization such as ISIA from Muslim and Yakum from non-Muslim, but the services not only for that religion, but also the services is for general society.
Oh, excuse me, can you give our friend from Indonesia a few minutes?
Yes, she's responding to Reiko's question.
If you want to
yeah, you can have a
make people,
conversation.
you can, feel free, feel free to make your information the next. Thank you very much.
Okay, the Secretariat wants to inform you, for those who would like to have food again, it's actually outside of this room.
Okay, is that, ooh, that's loud. Good afternoon, everyone. We will start in 1 to 2 minutes. If you don't have an interpretation device or you have lost your interpretation device, please can you pick one up at the back of the room for this session? Thank you.
Somebody else
Yes,
will
you
be.
can move if you want. Okay, good afternoon, everyone. We're all ready to start. I hope you had a wonderful tea break. If we could get the music. Oh, yes. Okay, well, thank you so much for joining this session. My name's Meredith Wise. I work for the Asian Development Bank, and I work specifically on ADB's work on aging and care. And this session really is looking at this aspect of care with a specific focus on home and community care. Many governments in the region have really put this at their cornerstone of their care policy. And this session is really looking at some of those innovations from across the wide region in terms of the initiatives to really develop home and community services from the policy and the practical level, identification of some of the gaps, looking at some of the tools that we're seeing in development, and then really looking forward. And we'll also be looking at the issue of caregivers as well, because we know they really are a key actor in this and actually provide the majority of care. So we have a very, very distinguished panel. We're going to do it in 3 short blocks. We're starting off in South Asia with India, And we're really, really honoured to have Additional Chief Secretary Punet Kumar to help explain what Kerala, which is, as he will explain, is really at the forefront of population ageing in India, what their thinking is, and really how to strengthen care services in India. As I said, he's the Additional Chief Secretary to the Government of Kerala in the Social Justice Department, and therefore in that role he is responsible for planning, policy and implementation of various government programmes for persons with disabilities, senior citizens, orphans and transgender. He's also a member of the high-level committee constituted by Niti Aayog, the Government of India, to develop the comprehensive strategy for senior citizens' care in India. So can we welcome Mr. Kumar? Thank you.
Very good evening, everyone. The delegates from all across various countries and the super specialists of the ADB on this subject. From India, presenting the state of Kerala in India, which is a very, very special state. Though India is basically quite a young population with just 10.5% of its population as senior citizens as of now. So Kerala is a very rapidly aging population. Yeah. So Kerala is a very rapidly aging population due to better health care and education, higher life expectancy, better climate, less pollution, a very higher happiness quotient because of the community support systems in Kerala, which have been going on for very long. Keralites have prioritized their health and well-being from very early age, and life expectancy has been now 74, which is way ahead of the national average, and this has 15% increase in the last 20 years. And by 2036, as I mentioned, it will be around 23% of the population will be senior citizens, and growing dependency is also one of the major cause of concern. Youth migration from Kerala is causing further more trouble for Keralites because, as you may be aware, about 1 in 5 Keralites are working abroad, and this number is basically increasing day by day. Most of them are basically also going as nurses and the caregivers or the home carers in other countries, since they are in huge demand, and because the health sector in Kerala has been very, very advanced and they have systems of training, skilling, etc. But the problem is that once they get better employment opportunities, they move to the obviously remunerative places. Kerala places elder care as the top priority in its governance. Government of Kerala was one of the first to come out with the old age policy, and it was revised in 2013 again, and now in 2024 we are at the verge of almost revising it based on our learnings, experiences and the lessons that we have derived by implementing this. We have created a legal framework, and we have an act in India that is called Enforcement of the Maintenance and Welfare of the Parents and the Senior Citizens Act. In many places, parents are abandoned. But here in India, just to take care of the parents and making sure that despite the fact that the children are moving around and they are going ahead, but they can't ignore their parents beyond a point. And they have to take care of them, and they have to take care of their welfare measures also. This act is being very strictly implemented in India, which is giving a legal framework for the care of the senior citizens. There is a caregiver training support. Allocation of the state and the local budgets have been dovetailed. Caregiver training is being earmarked for the senior citizen, which is quite substantial for this. The help of the self-help groups like Kutumshri are also taken for improving the care, home care as well as community-based care. In the skilled workforce is their institutionalization of the large-scale training of the volunteers, nurses, caregivers, creating a high-quality manpower pool for the elder care. Now, while this is the case, Kerala government has chosen to provide a comprehensive mechanism for the care for the senior citizen. One is financial assistance by way of the old age pensions. Then there are medical care, and these are some of the schemes which are either given on individual basis, and these are all colloquial names, Vayo Madhuram, giving free glucometers to manage the diabetes, Mandahasam for giving artificial dentures and the tooth sets, Vayo Raksha, emergency medical, old and geriatric care, caregiver services during the crisis. Similarly, Vayo Mitram, mobile clinics, palliative care, help desks and counseling for 65 plus years. The fact is that Kerala has been one of the first states within India which came out with a specific Kerala palliative care policy. And based on that, even the federal government had also come out with the national policy for the palliative care. Further to that, the medical care in Vayo Amritam, there is free holistic Ayurveda treatment. Kerala has specialized in Ayurveda, and traditionally this form of treatment is liked by Keralites, so much so that now people from across the globe visit Kerala for Ayurvedic treatment, which is Indian system of medicine. And this is also dovetailed with the medical care system which is provided for the senior citizen, because they are very much at ease with this. We have dementia care centers, memory clinics and full-time care centers for the dementia support. Almost 0.2 million people are there with Alzheimer's and dementia, and these are the ones who are having this kind of thing, and we have a separate specific old age home also for people with dementia and similar disorders. Palliative care I just mentioned. Then for nutrition, Vayo Poshanam and Sayam Prabha homes, these are the ones which are providing food kits and nutrition. Then we have socio-emotional support, again through Sayam Prabha daycare centers for the recreation, entertainment, overall involvement, so that they are participating and they are not isolated, they are not suffering from the loneliness. They are given various opportunities for the vocational activities, social interaction and emotional support. The neighborhood palliative care is also part of this social emotional support, in which community support is basically one of the prime movers and the drivers. Then we have Vayo Sevana. In order to encourage people or the NGOs who are working for this services, they are given awards. So in a way, the respectability to the senior citizens is institutionalized. We have Vayo Raksha giving financial support for the medical emergencies and even assisted devices, as all of us know, and people have been dealing with this particular issue. Most of the senior citizens suffer from disabilities, including deafness, which is increasing day by day. And this requires hearing aid and lots of other similarly placed assisted devices for locomotive disabilities and other things. Kerala does give support for all this kind of thing. Financial assistance is also given for the old age home projects, for the Vayo Santwanam, giving to the NGOs. NGOs run almost 200 old age homes, and Government of India has dovetailed with them by giving them grants at the rate of rupees 1,100 per month per inmate of those particular things, and the deliverables are monitored. Then we have review of the elderly program and the grievance redressal system. Again, they have the participatory approach. Comprehensive legislation, which we have mentioned. policy and legislation regarding old age homes and the palliative care policy. So this is the comprehensive thing. And these are 7 key gaps in the geriatric care in Kerala. I would like to start speaking on these issues, but before that, I would like to mention that world over, we are guided by the numbers. People above 60 years or 65 years are considered senior citizens. May not be necessarily true. For someone in any developed country, maybe United Kingdom or Australia, a person at the age of 70 may be playing badminton, maybe playing golf, maybe playing tennis, and he would be perfectly fit and fine, having no symptoms which are commonly seen in a stereotyped senior citizen. So, idea is that we must do the survey. We must assess what is the need assessment, and the criteria should be frailty. How is the frailty going on how the past life has been, how the health care has been undertaken, whether the persons have got the emotional support. Societies which are having very strong cohesive community support and bonding will not suffer isolation, will not suffer so much as the societies where they are living absolutely alone. So this frailty index must be the criteria for determining the senior citizens, and then after that the means testing should be done, how this is going to be financed, whether it is by way of insurance or by way of some taxation systems, etc. Now, based on our experience of dealing with various schemes and what is going on across the world, seeing the globally best practices, these are the 7 key gaps which have been identified in the geriatric care. Lack of skilled workforce, because people, though they come up, but they migrate. Then the lack of accountability, because there is no regulatory mechanism as such for the caregiving services agencies. There is no monitoring, and inconsistent and inadequate care is there. This needs to be more institutionalized, and regulatory framework is important. Urban versus rural disparities. This is more